Gerald. Today I want to talk about the shoulder. So be on the lookout as we take a drive into shoulder pain and understand exactly how it arises, what causes it, and what we should do should this condition occur. The shoulder joint is that joint formed by the glenoid cavity and the head of the humerus. As I have here, I have a bone showing this is the scapular bone, and right here is the glenoid cavity. If you have pain in the shoulder joint and you also have difficulty with breathing, I want to say you have to see your doctor, because that may be an indication of a heart attack. There are important investigations that can be done. These investigations will help the doctor to confirm the diagnosis. The number one investigation that is very important is the X-ray. The X-ray is going to help to show the bone as I have described in the model that I used. It would describe exactly what is going on within the bone of the particular individual. Other better ways of defining the shoulder joint could be the CT scan. Sometimes you can also have the MRI, the magnetic resonance imaging. This would help to show some of the soft tissues and depict them even more clearly. In my experience with arthroscopy, it has been very helpful. Why? Because it's done as a day case where the individual has the procedure done on that day and the individual can also go home on the same day. I want to start by talking about bursitis. A bursa is a small fluid-filled sac that is usually found within the joints surrounding the tendons, giving the tendons the cushioning effect and rubbery effect to reduce friction for them to perform their function effectively. Tendinitis is another thing that can happen in the shoulder joint. You can also have another condition which is referred to as a tendon tear. There can be a tear in the tendon. This usually will follow sports injuries and can also follow overuse. Another thing seen commonly in the shoulder is called the impingement. Sometimes we call them the impingement syndrome. The impingement syndrome occurs because the tendons that are within the shoulder are right sandwiched in between bones. So as we described, you have that these tendons have to slide in between these bones, and when they have been used over a long time, probably in the case of overuse, they can result in inflammation. And when they get inflamed over a long time, they can impinge and prevent the joint from moving freely. This can result in what we call the impingement. Another form of impingement that is usually seen in the shoulder is the subacromial impingement. Now this also occurs in the same way we've described, but is more common. As I described, right here is the acromion and underneath is the subacromial space. Now when the shoulder joint is formed, which is here, you have that once there's a movement in subacromial impingement syndrome, there is the impingement of the humerus on the acromion, and so that's one of the things that can result in pain. And even going further, it can limit the range of motion. Another challenge that can happen, or problem that you can see commonly in the shoulder, is instability. Mentioning that we have ligaments and tendons that stabilize the shoulder joint, and remembering that the shoulder joint makes a very wide range of movement. That is to say, it can move in flexion, elevation, it can go in abduction, and it is the joint in the body that has the widest range of motion. So, giving away from this widest range of motion, it loses it to stability. So, if there is a disruption on any of the structures that stabilize in the shoulder joint, ranging from the glenoid labrum to all the way to the tendons, to the rotator cuff, you can have instability where there is any form of movement of the articular surfaces. It can range from subluxation all the way to complete dislocation. Now there are different kinds of dislocation where the shoulder can dislocate anteriorly and the shoulder can also dislocate posterior. There's also inferior dislocation, and all these can happen within the shoulder joint. Another problem that you can find commonly in the shoulder is arthritis. I'm talking about osteoarthritis. Now this is as a result of wear and tear that comes with age in an individual, resulting in the wearing off of the articular cartilages that are lining the glenoid and also lining the head of the humerus, resulting in pain when there is a bone-to-bone contact, which can be very painful, resulting in shoulder pain. These are some of the reasons why patients will present in the hospital with shoulder pain. So which one is it that you have? Now, going further, we will not complete this discussion on talking about causes of pain in the shoulder without talking about fractures. Now, the shoulder fracture, it can also occur. Fractures that occur around the shoulder joint, like fractures of the head of the humerus, fractures of the neck of the humerus, and fractures of the glenoid, and also fractures of the acromion. Though not very common, but they can still occur and be a source of pain to the individuals. And just like we said, when any of these occurs, there are symptoms that the individual presented. Number one is that there is pain in the shoulder, there is a limitation of movement, and then going further, there may be deformities. Now, what is the treatment that is offered to people with shoulder joint? It will be good to say that the first thing you'll be advised is to go ahead and see your doctor, so that your doctor can help you make the appropriate diagnosis. As you can see, we had a list of several things that can be the reason for you having shoulder pain. And one of the things that you can do on your own once you have shoulder pain is to rest the joint. It's called resting the joint. By applying a sling and putting the arm in that position, you put the shoulder at rest. And then you can go see your doctor. And then from there, your doctor can, by examining, doing the right investigations, confirming the diagnosis, can offer you, number one, medications that will reduce your pain. There may be need for you to have some massage guided by a physical therapist, and also there may be need for you to do some muscle strengthening exercises or range of motion exercises, as the case may be. Not forgetting, where the pain persists over a long time, your doctor can also go ahead and give you what we call an intra-articular injection. Yes, this can be done. Now, sometimes injections can be steroids, and I want to tell you, your doctor is going to counsel you appropriately, because there are consequences that can follow the use of steroids, and you'll be told on the number of times like you can use that kind of injection. For in my own case, I usually give it about twice a year, and then we'll go ahead to do something else for my patient. Lastly, it'll be good to know that the case, depending on what it is, may degenerate to the level where you might require surgery. Surgery could be open or it can be arthroscopic. Now, whichever way it is, make sure you ask questions to your doctor, get the appropriate complications described and discussed with you so that you can have the best outcome. Don't die in silence. Don't continue home care. Many have decided on their own to continue taking medications over the counter. This has resulted in severe complications. Many patients I have met have gone ahead to take steroids over a very long time to stop their shoulder problem. And unfortunately, the steroid overuse or long-term use has resulted in what we call avascular necrosis of the head and complete destruction of not just the shoulder joint, but this time stretching to destroy all the other joints, including the hip joint of that particular individual. And this will now result in the need for major surgeries that are very expensive and could also have high morbidity rates. So I want to encourage you today that what are you going to do if you have problems with your shoulder? We've said, see your doctor. Lastly, before I leave you, I will not complete this discussion without talking about prevention. What are the ways that you can, what are the things and ways you can perform or behave so that you don't have shoulder pain? One is for you to adopt appropriate posture. Whenever you are in any posture, make sure it's appropriate. You're standing, stand upright. You're sitting, sit upright. You're lying down, lying on your supine, that's on your back posture, and also you can take the sides. You make sure that you exercise your shoulder carefully as guided, and also build the muscles around your shoulder. If you're someone that has had a history of shoulder dislocation in the past, you may have a risk of recurrence, and so you must see your doctor and have a physical therapist guide you on how to train the muscles to increase the stability around your joint. So today I want to say thank you for tuning in once again and listening to us as we take on this important topic, shoulder joints. I want to say I hope that this discussion has helped you largely so that you can live a healthy life and stay strong. And that is why we're here bringing you this news. Thank you very much for listening. See you again on another of our session. Thank you. Bye.